team work closely with other teams. Tell me about how you work with those relationships and how you maximise them.
So we have developed a lot of relationships and partnerships with people across the community and hospital settings, and they include our social workers within the hospital and all the other health professionals, including our treating teams and geriatricians. We work very closely with the Office of the Public Guardian, as well as service providers and aged care facilities, in order to ensure that we are working in the best interest of the clients. The reason why these relationships work so well is because we all have a common goal, and we have invested the time to understand each other's processes and limitations and work together on a basis of trust, openness and understanding. We've recognised the value in investing in these relationships, and it's resulted in us being able to streamline our processes when it comes to working with referrers who are referring clients for younger people with disability. So for example, with the social work department, we've encouraged them to contact us and discuss complex clients early, as well as we provide education to the social workers and hospital staff. Another example is with the Office of the Public Guardian. So we identified that we weren't working as collaboratively as possible, and we ended up meeting with them so that we could talk about our processes and their processes and how we could come together in order to ensure that processes were streamlined and the client's needs were being met. So another thing we've done is we've developed a working party amongst the social work departments and the ACATs across the local health district in identifying areas that we could improve on. We've put a focus on keeping the client at the central focus and looking at how everyone can come together to achieve the best outcomes for the clients.
Rosie, what's a good outcome for a young person with disability who's referred to your team?
There are lots of different things that have to go well for a good outcome to be achieved, and I think it starts with both the client and family being engaged. The social workers working collaboratively with the aged care assessment teams and contacting us very early on in the process to talk about the client and discuss what the options are, making sure that all the options have been explored and exhausted, and that's inclusive of going through the disability sector. And so then we know when the referral does get to the aged care assessment team that it's more than likely that the client will be approved, and we know that the referral is appropriate.